Just under half of marriages now end in divorce, and there's been a sharp rise in people going to couples counselling to deal with their relationship problems. In a recent episode of their TV series, we saw Stacey Solomon and loose man Joe Swash attend a joint therapy session to help Joe after he was diagnosed with ADHD. And it was pretty hard-hitting stuff, a little awkward at times. Stacey said while she knows Joe is a great dad and he really tries hard, she gets frustrated that he puts in loads of effort into the wrong things, meaning she has to manage things on her own. So, Sam, you've spoken about your ADHD. You're very vocal about it, very honest about it. In the clip, there's one line from Joe, and Stacey was, I'm just being really honest, and he said, all I'm hearing is I'm a huge problem in Stacey's perfect life. I don't hear any positive stuff about me as a person. All I ever try to do is help me and my family. Does this resonate with you?
Yeah, massively. I mean, I think it resonates for anyone with ADHD. I think I feel a lot of empathy towards Joe. I know him personally, he's a really nice guy, but also, you know, if you watch the clip, Stacey is actually saying some really lovely things about him prior to that. She is saying, you know, he's a great dad. I can tell that he's trying. But I feel like it's almost the fear, because you know what you should be giving and you're being told what you should be giving, and it's the inability to sometimes do that, and you feel like a failure. And you feel, I think, really sort of embarrassed with yourself. And it can then turn into that kind of back and forth where there's not really any winner, to be honest with you, I don't think. And it's a really tough, you get very insecure. I mean, I've been literally in that exact same position many a time with my family and friends and everything. So it's, I feel a lot of empathy towards him. And I think it's just, therapy is one thing. ADHD therapy actually is another thing. And I mean, far be it from me to start giving advice to Joe Swash, but that may be something that can really, really help.
The key thing, Amir, about couples counselling is there are no gaps left, OK? Because you can't spoof. The other person's going to go, actually, no, this is what they do. So I can see the merits of it. Yeah. It does work, right?
It does. And couples therapy it's done at different times in your relationship, depending on what's going on. For a lot of people, particularly the people who come and see me, it's because the communication in that relationship has broken down. Perhaps there's issues with intimacy, which causes problems in the relationship. So they'll go to the therapist and talk about how they can improve that level of communication. And it's important to have a therapist. You're not just going there to validate your own feelings. The therapist has to challenge both of you and get you to compromise on both sides. The other time people might access couples therapy, and this sounds a little bit smug, but it's when things are going really well in a relationship and they want to maintain that level of wellness. You're looking a bit confused.
Because no one's ever going to be doing that. When things are going well, no one's going to therapy.
Hey, Doc, look how perfect we are. Oh, shut up. Sorry.
No, but it's true. And the time to do that, I would say, is before you make a big commitment, like marriage, buying a house and buying a puppy, perhaps, because you want to make sure things continue to go well and you manage each other's expectations of that future relationship too. So therapy is important. What I would say in terms of the ADHD and what Joe said there, parents often come and see me if their children have got symptoms of ADHD, they're worried about a diagnosis, or even adults who think they may have ADHD. And we often think about the challenges that ADHD and being neurodiverse presents, but actually there's so many positive things that it has as well. I mean, you guys are examples of how amazing it can be. You know, the honesty that comes with it, the empathy that radiates from people with ADHD because they have heightened emotions. It's so important.
We are quite emotional.
You are. Right, and that critical thinking and that creativity, there's so much positivity that needs to be embraced with neurodiverse people as well.
Sam, you're single now.
Oh God!
Right. So you got a little kind of a guides now for someone you meet how to make it all work. Okay. Yeah. Maybe go for the early counselling day one. Maybe make it a date.
Yeah. Well, no, I go to therapy once a week. To be fair, I struggle with watching that clip though sometimes because I'm like, this ADHD and neurodiversity in general is so complex. To plonk yourself in a situation like that where it's just like there's cameras there. It's a couples therapy session, but there's so many layers to ADHD and stuff.
You've got some very interesting divorce statistics, not your own personal ones, although they are interesting, but in general, it changes, right, over the number of marriages you've had.
Yes,
or one has had.
That's right. I was sharing with you all before the show that, you know, apparently it's 50% divorce rate for a first marriage, 2/3 likelihood of divorce for a second, and 3/4 for a third. And I think what that's about is, first of all, you're bringing a lot of baggage into later marriages in the form of children, exes, all sorts of things. maybe financial hardship too, because you're dealing with paying for other people's allowance, as it were. But I also think there comes a point where you think, I can survive this. You know, a lot of people, I'm not in any way advocating divorce, but a lot of people who don't get divorced are probably very frightened of doing so for very valid reasons. But I think that the reason it becomes a more open option is because you've survived previously.
What role has therapy played in your life over the years, over the traumas, the dramas?
It's been huge. I've had conventional therapy. I've had a sort of almost a brain-altering one. But the one that's been most useful to me is called EMDR, which is about, it sounds like woo-woo, but I promise you it's worked, certainly for me, which is, it's trying to pull together the two parts of your brain. The human brain has one part that is emotional and one that's practical. And a lot of PTSD, which is something I've had, gets locked in the emotional side of your brain. And EMDR is a way of opening up through getting the two brain parts talking to each other. It's accessing some deep-rooted trauma and brushing it away. And I'll give you an example, actually. I went with a particularly brutal image in my head to a session of EMDR. And it was to do with me being told that my mother had left home when I was a very small child. It's something I always remembered in Technicolor. And then the next week I went back, having tackled this in an EMDR session. And the next week, the Technicolor had gone. I couldn't even remember what we'd been talking about the previous week until prompted by the doctor. And then the doctor said, well, it's this. And I went, oh, yeah, I do remember that. But what had been a Technicolor nightmare memory to me was just the little grey lines that you might get from an Etch-a-Sketch. And I'd shaken it away, like you can, get rid of something. It really works. You tackle the trauma, you put it in a place where it can be processed, and it's gone.
Wow. It's very interesting, Amir, isn't it? You can do something mentally that does change things physically, as it has done for Charles.
I think EMDR is such an important tool. It stands for eye movement desensitization reprocessing. And essentially, as you were saying, you know, if you've got a very traumatic experience or have PTSD, your brain locks in that experience as it happened to you that time. And every time you think about it, all those emotions that are associated with that trauma come back, and it feels exactly the same as going through it. So during these sessions, what you have to do is engage both sides of your brain, which is why you have to use both of your eyes. So generally, you're asked to think of that trauma, bring those emotions to the surface, and then the therapist will ask you to follow something, usually the finger, with both of your eyes, and you follow it, and that slowly helps you reprocess it. We're not quite sure exactly how it works, but it's got something to do with rapid eye movements, similar to when we sleep and we cement memories in our sleep, in our REM sleep, and that helps you digest that emotion and then deal with it in a much more healthy way. But therapy isn't for everyone. EMDR is good for PTSD. Some people will go to therapy, be really open to it. Depending on the chemical structure of their brain, they may not respond to therapy in the same way other people do. It doesn't mean they're not open to it, doesn't mean they don't want to get better. It's just not for them. And perhaps for them, medication might be a better option.
Dr. Amir, part of the role of this show is to get men talking, thinking, people thinking, and taking control of some issues they want to deal with. So if there are people watching at the moment going, you know something, we should do this. Yeah. How difficult is it to organise therapy, to get booked in?
So go and see your GP first off. There's lots of different ways you can access therapy, either online, one-to-one or group. And they all have different waiting times, but the online stuff is really quick and easy to access.
And what's that stand for, EM? What's that stand for again?
Eye movement desensitization reprocessing.
Yeah, I'd need therapy with the stress trying to remember that too.